This is Steps podcast, episode 1. If you've watched the introduction, you know what to expect. Today's episode is going to be about what good leadership looks like in child mental health services and wider services in general. That's what we're going to look at today. I want you to subscribe if you haven't subscribed yet to the channel. Just make sure that you get notified if you want more of this kind of content. Let me know, and then we'll go for some questions today. Questions that have come in, and then we'll answer them in this context. A lot of the questions have come in themes, so you'll see this one talk about child mental health leadership. So we will be looking at these questions together. And we'll kick off today. Leadership in the context of child mental health. So children with unstable mental health need services to support them. The biggest services they need to support them are their families around them, and then primary care around them, and then secondary care and intensive care services around those. That's the way the system should work. The most well children should be in the middle. That roughly will take about 80% of the population, and the rest of the 20% of the population who are struggling with their mental health will fill areas around that. The I Thrive implementation strategy talks about this donut, with the center hole of the donut being the well people around that, and then splitting the 20% into these 4 sections of what kind of services or what kind of needs they need. It's basically a needs-based system. The tiered system looked at it slightly differently, where you would get iller throughout the system, but really didn't really address those who are well and how to keep them well. With the Thrive modeling, it looks at the well and how to keep them well. And really that is the essence of leadership. The leadership is to really see your service or wherever you are, and making sure that at that 80% who are well, how much investment, how much planning, how much strategy is going to go into keeping those children as well as possible. And then you lead your services and design your services to manage the needs of the 20% or so children who are between slightly challenges with their mental health to the most acute and at-risk children. That's how you would manage it in leadership. So specifically for leadership in children's mental health, everyone's had a sick child and the parents become very sensitive. Sometimes when you can't see the illness, we become very kind of defensive, and we have to understand and appreciate that families are not doing this by intention. They're just trying to protect their children. Sometimes the children themselves don't want to open up, so you have to create good, clear, open services where people feel safe, people feel comfortable, people feel able to engage with your service. We do not want tokenistic kind of change bits of the service that don't really matter. We want people to come and be included in the delivery of services. Once you can achieve that, then services will be far, far, far better. So if you're a good leader, and we'll come on to what that good leadership looks like in a minute, because I know everyone wants to see that, but I just want to make sure that everything should be outcomes driven. Everything in your service delivery, everything that you do, whatever service you work with in child development services, in CAM services, speech and language, whatever it is, everything we do should be outcomes driven. So you need to pick a metric, which is the core metric for your service. What is the ultimate thing that this service needs to do? So what I would advise is the leadership needs to be brave and say, for example, in the child mental health arena, we say no child, we're working so no child comes to harm. Okay, aspirational people will say it's not really realistic. If you put the mentality behind that, no child will die by suicide, for example. No child will die by harming themselves. You have to start having that mentality as a leader, and then opening the conversations up with your staff so that they're comfortable to tell you what's preventing us doing that. Having lovely metrics that say we need to see children within a certain amount of time, having other lovely metrics saying we need to make sure that we see children getting better or worse through outcome measures is very good, but it can take away from the core essence of what a service needs to provide. Core essence is to keep children safe. Once you keep them safe, and that could be at the very acute end, but also at the very preventative end, to stop that escalation happening. That's how good leadership can develop services to make them stronger and better and faster at responding to cases where things can escalate quickly. The other side of good leadership is really be a really good organizer. Okay, see a process, understand its chaos, understand that you've got where this whole thing happens, what happens, when it happens, how it happens. And we may bring people in to talk about this more. But once you process map what you do and be very methodical with that, process map what you want to do with your services, how your services want to run, what happens at each step. Is it a decision step? Is it a process through step? Is it a bureaucratic step? You can remove a lot of the waste from your system, but you need a good systematic approach to that. Something you should do every year. If you do it on your own as a leader, do it on your own as a leader. If you do it as a team, it's much more healthier. If you do that process with your team and with your stakeholders, with your partnership, it's the best model that you can have at all. And those are the characteristics that you want as a leader. We'll move on to the characteristics at the moment, but those are the essence of good leadership in this field. You want to keep children safe, and you want to have your services organized in a way that is methodical, repeatable, and understand that if anything happens, your staff are comfortable enough with you to be able to come to you and express their concerns about the service. Because if they don't see it, there's going to be someone outside that sees it, feels it, and that's already a risk itself. Our staff, our people know the services, know what should happen, and then you need to make risk versus benefit calls in terms of everyone's got a finite financial envelope. How do you organize that envelope to meet those needs and to put it where most risk is? And that needs to be fluid. That needs to be, okay, it's risk, but then you can move back, you can step back. You need to be dynamic and fluid, and you need to get a culture within your staff so everyone is working in that way. But in terms of being an effective leader, so people ask me then, so what makes an effective leader? Okay, and some people say, oh, I'd like to just do it like you, Sam, or I'd like to do it like this person. The idea is, again, I say this about all services, wherever you are. Okay, an effective leader is someone who has observed the leadership of others, learned from others, and most famously, I would say one of my previous managers in the NHS said to me, Sam, when you move into your leadership positions, remember every single poor leadership person or decision that you've felt, that you've seen, and vow to never repeat it again. Because learning from mistakes is the most crucial thing. If you come across a scenario for the first time, go and find someone who has done it before. If you can't find someone who's done it before, then make your best effort. Be prepared to learn. If you've done something for the 100th time and it fails on the 100th time, something in your system has changed that's caused it to fail. And again, this is what makes it effective, to be able to respond and change your services to learn from that. And the other side of effective leadership is to go across other services, other child mental health services, but more importantly, go to other services that are brilliant, that are outstanding, and go and learn from them. Ask questions. You don't have to. You can speak to families. Like I said, I'm obsessed with Facebook groups and stuff like that for many a year, and you can get all your answers there. And then you'll see a clear disparity between services where you work or live, and then services where there is phenomenal, outcomes. You can do that there. So that's the last bit about the effective leader, and we'll come back to that. We'll come back to this point. This is really important. So I'll emphasize it again towards the end of the podcast, I think, is you need to have an ability to create more leaders. Okay. Normally leadership is about making decisions and people trusting your decisions and you going forward and driving things forward. But you need to also, at the same time, look at your people around you and who wants it, who is capable for it, who's capable of doing it, and actually does the service need that kind of person. Okay, so leadership, but that person might want it. It might not be perfect for certain services, and that's okay, because other services will not and will take them on, and you shouldn't be afraid to lose them. This is a big fall. Once you stop training people, getting them to grow and stuff, and exposing them to new challenges, they end up getting disheartened and slow and sluggish in your own service. And that's not really good. You'd prefer them to rise, promote, get better, and leave than to stay and be disgruntled and be unhappy, because they take those qualities that you've learned in your service, that culture, and they'll go and embed it elsewhere. And that's also true for bad leaders as well. Bad leaders will also cause people to leave, and they take those bad cultures and go elsewhere. So those are the things that I would say are very, very important in terms of the characteristics of effective leaders. So in terms of a role, when you're in a service leader position, I talked about a little bit earlier, but you really need to be able to make decisions. You really need to be able to listen to everybody's opinion, get everything down in an organized way, and make decisions that have impact. You need to have your core tenet of what you want out of this, but then you need to make decisions based on that. Track them, understand them, learn from them, share them if they're good, share again what mistakes you've made so others can learn from them. And then you need to kind of identify and address these gaps that you find, because these gaps exist all over the country, everywhere and all over the world where there is a need for mental health services. Once you can identify these gaps that you find through improvement practices, trying to get better, you can then, say, make a bid for funding, reorganize your services, reduce your funding because you don't need that service anymore, and then move things elsewhere. And you can only do that if you can really have that ability to improve services. Okay, there's that dedication to improve services. The other thing that you'll find as a leader is you need to understand, you need to be a good reader, because you need to be able to read all the evidence-based practices, all the policies and all the procedures, global, national, and then local to your cause. Once you understand how to do that, then you can make risk-benefit decisions. You can challenge what evidences people are purporting to be the right right evidence-based treatment. You might have evidence-based treatment that's come from a place where there has a certain, for example, demographic, and you're working in a very different demographic, and you should be able to challenge that. But if you don't read the policy, know where it comes from, know the context, then you're not going to be able to do that at all. We're going to move on a little bit to some of the challenges that you're going to face as a leader. So services are generally stretched, and people want these services more and more and more. If they're incompetent, they may not want them at all. But if you get good at what you're doing and your services start delivering, even how small they are, people will want more. So you need to keep a track of your supply and demand. It's so important. You need to know how much supply you have, how much demand you have. One day in the future, we'll do another podcast on how we manage that supply and demand. We'll talk about a bathtub, and I'll talk about that. And if you want to hear that, let me know in the comments. But it will come over time. So these challenges are really, really important to understand. You've got people who want you as a person, and you've got a finite amount of time to give. And then there are people who want your service, and that's got a finite amount to give. And then you've got to be able to articulate where the needs are, where the gaps are, and how you're going to address those gaps. If you can't, then you struggle. But the solutions are organizing your time as a leader, understanding, and again, we'll do time management. I have it on another channel where we talked about how to manage your time, and I have a simple four quadrant matrix that we use. But if you manage your time properly, you will be able to get things done efficiently and effectively. And then your service, similarly, if it can manage to do as much proactively as possible, you will be able to manage your service much better. Collaboration is going to be key. Collaboration with your team, collaboration with your leadership team, collaboration with your patients, carers, collaboration with your partners, so your schools and your GPs, your primary care. I did talk about that. In child mental health is basically a family, and around the family is the primary care model in terms of care, healthcare. So you have your GP, your schools, and that's the people who are going to support, because they'll meet the family most. And then around that, you might have your secondary, your community health services. And then around that, you will have your specialist centers around that, offering consultations. Support. If you get that right, so if you're able to have patience and a high threshold for challenge, and it encourages you, you can make very big differences. Sometimes these jobs can take 50, 60 hours a week and some bad weeks, sometimes more. But generally, if you get yourself organized and your service organized, and you trust your staff and your staff trust you, you can get the job done in the amount of hours they're giving you to do it. So the next bit that we're going to talk about is, how do you lead change? So leadership in these child health services, child mental health services is what you need. Sometimes change and influence. So sometimes things need to be done and staff may not like it. So the first thing you need to do is be able to communicate clearly, compassionately, what needs to be done. That could be because things have changed and you have no control over it. But where you do have control over it is to understand. That's why landscape and policy and what's happening will end up trickling down to you. So you need to read those policy documents that come out 6 months or 9 months earlier, so you understand what's coming your way. It's coming, and you just need to be able to organize. So you start to drip feed your service that this is coming, or we need to change this, or we need to move things around a bit. Okay, so we can receive that, because when you're ready, if it's new funding, you'll be able to receive it and create good outcomes. If there's going to be a constraint, then you're ready and your service is already prepped for it, and you know it's coming. Okay, be always clear with your communication. When you do change management, there are different models that you can apply, but you have to always understand there is a change curve, and you have to have some patience with those people who are not going to be early adopters of your change, and they're going to have some kind of reins on the people who absolutely want change, want to innovate, the first adopters. You'll need to rein them in, and you'll need to create some kind of buddying program, and then supervising that, where some of the early adopters can coach some of the laggards or the late adopters in your change process. So change is great. Okay. So when you walk away from the services, do the changes still hold their water? So if you were to walk away, so you have to ask this question in your own self-appraisal. If I walk away from this thing that we've moved, will it keep going? Yeah. And the way that you know it's going to keep going is, we've talked about it, is in you need to create leaders within your leadership team. Developing leaders, developing people with those qualities to be able to hold, understand, listen. Those are the ways that you know that these changes are going to be sustainable and have long-term impact on your services and your service users. So we're looking at outcomes. When you look at outcomes for a leader, you've got to pick your own outcomes. You'll have an appraisal with your manager, and it's going to be clunky and unsophisticated because most systems are. You need to create real live quality metrics. Okay, so how many people come to harm in your service? This is your responsibility. Really is your responsibility. And look at that, and look at how you're going to change. That's how many staff have been unwell, how many staff have left your service, how many new people have started, how many families have complained about your service. These are all things that relate directly to you. When I first walked into the service, I had a list about 100 or 200 complaints in the drawer. My boss said, "Here you go, get through that." Very nicely, but again, I could see. And very, very quickly, I skimmed them all. And really, then I developed themes, so that I divided them into 3 piles. The main pile was, we can't get your service. We're waiting too long. So I clearly knew some of the other stuff was a little bit more technical and and again, smaller. This was the bulk. So I knew that was the primary thing. We needed to work on getting people to see our services quicker. And then there was something in statistical fat tails. So I did have a look at the very difficult ones where there's risk. And then there are risky things that you need to address straight away, even if it's only 1 or 2 complaints, because that could be very, very dangerous. Look at that as well. But the bulk of the complaints were here. That's kind of like how you deal with outcomes. So this is a way of doing outcomes. I have complaints that look like this. And then, so 2 or 3 years down the line, we had a smaller number of complaints, but they were rather than we can't get your service, is your service isn't very good, or your service. But then you knew that there's a change already. You knew that there's a change in terms of what services we need. Well, there was no service before. At least now people are getting the service. People always complain, and always take complaints as a way of feedback and how you develop your services. So then you just continue this cycle of improvement. And I want to stop and I want to end on this idea of developing future leaders. If you're a leader in mental health services, if you're a leader in any services that you want, make sure you are creating and cultivating a path for future leaders. Because if you've learned so many skills, and this podcast is one example of it, if you learn all these skills, you're going to take it away and you're going to move to another job, you're going to become a director or something where you're never going to have that access. You need to share this information as much as possible. Take a couple of people down as mentees. Do some coaching if you can. Go and get a coaching certificate. Try to coach people so they can think for themselves and get themselves out of a tangle so you can help them. These are the things that I want you to make sure that what you do. Please, please, please. Mentorship. Get people that want to become leaders to become leaders. And also encourage people that have the skills that maybe don't have the initiative. Cultivate them. Change their mindset, because these are the way that services are going to get better. If you need our services at CamSteps, then reach out. And this is the end of episode 2 of the podcast. Thank you for listening. Leave any comments that you want, anything else you want answered, stuff like that, and then we'll come back and we'll do them again. See ya, and we'll see you in the next one.